Two of my brothers have died by suicide, John in 1994 and Michael in 2018. Being a suicide survivor, I became very aware, or at least perceived, that those struggling with their mental health were stigmatized and judged. Because of John's death and hoping to escape our history and the perceived judgment, my siblings and I each moved away from our hometown as soon as we were able. That is when I moved to the Grand Rapids area in 1996. With my brother John, I did not notice signs or changes because he was much older than me and we were not very close. He was living in Atlanta at the time of his death. I was much closer with my brother Michael and noticed signs and changes in him prior to his death. Following John's death in 1994, my brother Michael struggled with depression. There were periods of time when Michael was a recluse and didn't take care of himself or his home very well. Despite his mental health condition, Michael ran a successful business and had friendships and positivity in his life. He actively participated in counseling and took medication for his depression and anxiety to empower himself to get better. When Michael died in 2018, he was in the process of building a house and may have overextended himself during this project. The stressful task of building a house and the potential of feeling like a failure may have been contributing risk factors to Michael's death. Although I could see the stress in Michael, I didn't know how to help him or talk about it with him. It is so important that more individuals in our communities are trained on the symptoms and warning signs. We need to encourage and invite conversations that challenge individuals to seek help for changes in their mental health. By sharing my family's story, I hope to empower others to gain knowledge about depression and suicide and to gain confidence to take action when it comes to mental health. I miss my brothers and grieve their losses. The recovery and healing process following their deaths has been difficult and ongoing. I'm hoping that by learning the Be Nice action plan, we can work together to proactively equip others with the resources they need to potentially save a life.
We are in a time of high risk factors and stressors on our mental health. Already, healthcare professionals and those that work in a healthcare setting experience higher rates of burnout, depressive symptoms, and suicide risk greater than the general population.
When mental health conditions are left unaddressed, the risk for suicide increases. By using the Be Nice action plan, healthcare professionals can increase their knowledge about mental health, giving them the confidence to take action when it comes to mental illness and suicide.
University of Michigan Health West has decided to equip staff, colleagues, and patients and the community with the Be Nice action plan. This tool can provide mental health and suicide prevention support for yourself and those around you.
Health West values caring for people in their entirety, which includes both physical and mental health. Through the Be Nice action plan, we can foster a mindful environment that's focused on our whole well-being.
Be Nice is a 4-step action plan to notice, invite, challenge, and empower ourselves and others when it comes to mental health. Noticing what is good and right about someone gives us the opportunity to notice what is different about their mental health.
The next step is to invite ourselves to have an open conversation about mental health and suicide prevention. By challenging stigma, we can provide opportunities where someone can challenge themselves to get the treatment that they need.
The last step is to empower, which is giving power to our mental health every day with protective factors.
Illnesses like anxiety and depression can disrupt our lives and put us at risk for suicide. It's time that we take action together.
At UMH West, we need to care for our brain so we can care for others. When caring for ourselves and others, let's be nice.
En la Universidad de Michigan Health West debemos cuidar de nuestros cerebros para poder cuidar a los demás. Seamos amables y cuidemos de nosotros mismos y de los demás.
Be nice, it can save a life.
Be nice, it can save a life.
Sé prudente, puede salvar una vida.
Be nice, it can save a life.